Morning and Jai Hind, all of you. Today we will start our session with some of the discussion of disease. So, students, let's start. First of all, on your screen, we have discussed congenital and acquired disease, in which we have discussed that congenital diseases are those which are present before birth and acquired diseases are those which are present after the birth. In the acquired, we have discussed the communicable and non-communicable. In the non-communicable, we have seen that some of the diseases are those which cannot be spread from mild touch or cannot be spread by touching each other. So these kind of disease are called as non-communicable or non-infectious disease, in which we have discussed deficiency disease and degenerative disease. In this, now we will start allergies. Allergies are caused due to hypersensitivity. It means that if your body is very sensitive to any kind of things such as pollen grains, dust, silk, nylon, fish, drugs, uh, it's a common thing, student, कि आपका शरीर किसी भी चीज़ से एलर्जीज हो सकती हैं. फॉर एग्जाम्पल पॉलन ग्रेन्स, इन सम पीपल दे आर कंप्लेनिंग कि जब वो फ्लावर को स्मेल करते हैं तो उन्हें छींक आती है. दे स्टार्ट स्नीजिंग. So it's the allergy. Allergy can happens with any kind of things, even from dust. So the dust, nylon, fish, pollen grains or drugs which causes allergies are called as allergens. The substances due to which allergy is caused are called as allergens. So we have seen that allergies are those which are caused due to oversensitivity of the body from foreign substances, which are called as allergens. For examples, the examples of the allergies are asthma, bronchitis, and so on. Now, students, we will see some more interesting facts. There was two scientists, Australian scientists named Warren and Marshall. They have discovered that peptic ulcer, which is caused which is caused due to a bacterium known as Helicobacter pylori, was no more chronic. Because in earlier time, students, पेप्टिक अल्सर एक ऐसी क्रॉनिक बीमारी थी जो सही नहीं हो रही थी. एंड देर वर सेवरल पीपल हु वर वेरी इन सीरियस कंडीशन. They were in serious conditions because there was too much bleeding, too much pain inside the stomach, and at that time this peptic ulcer was too much chronic and it takes too much time to patient to recover from it. But due to the discovery of Warren and Marshall, two Australian scientists, they have discovered that there is an bacteria है जिसकी वजह से ये बीमारी हो रही है. और उन्होंने इसका पता लगाया और उसके बाद उन्होंने इसका ट्रीटमेंट भी किया कि इससे हम with the help of antibiotics, all of you, which kill fungi or bacteria. So they have used antibiotic to kill that bacteria, and they were able to treat that peptic ulcer. Now we will so they have got the Nobel Prize for the same. Warren and Marshall got Nobel Prize for peptic ulcer treatment and finding out of the cause of the disease. So now student, we will see some disease one by one. So on your screen, this is the picture of cholera patient. Cholera patients are become weak due to dehydration and due to over and over loose motion. They become very weak. So cholera is basically the bacterial disease caused by bacteria. So in this, patient loose motions is having, and so now this is the scene of fungal disease, skin disease, and now the third one is the elephantiasis, which is in Hindi called as हाथी पाँव, because elephantiasis name ही इस वजह से है because in this disease the patient legs becomes like an elephant, which is due to the worm. Now coming to the page number 93, we will talk in this section, we will talk about infectious disease, the agent of the infectious disease. So all of you, there are several agents of infectious disease. What are the agents? Agents are those which causes the infectious disease. You know, all of you. So there are viruses, bacteria, fungi, protozoan, and worms. These are called the agents of infectious disease because they causes the infectious disease. Now some of the viral diseases are common cold, influenza, SARS. SARS, the full form of the SARS is severe acute respiratory syndrome, mumps, chickenpox, smallpox, AIDS, acquired immunodeficiency syndrome. These are called the viral disease. Now coming to the bacterial disease, so typhoid, cholera, tuberculosis, syphilis, tetanus, and so on. Fungal disease, athlete's foot, ringworm, skin disease. Protozoans disease, malaria, which is caused by the female Anopheles mosquito. And the examples of the worm disease are elephantiasis, as I have shown you the picture of the elephantiasis. So this is all about the disease and agents of disease. Okay, all of you, in the next session we will meet with the new topic. Till then, thank you and see you again.